Welcome to this episode of Jing TV.
Welcome.
And we're going to talk about a key issue here, sort of osteoarthritis. So, Rachel, if somebody says to you as a massage therapist,
Yes.
Can I treat, i.e. can I change, can I make better osteoarthritis, what would you say?
I would say I can treat a person with arthritis, so I can't make a difference to the structural change that's gone on in the bones, but I can certainly make a difference to the pain condition.
There we go.
There we go.
So,
what is osteoarthritis, first of all? We better tell
yeah,
the people.
Probably good.
Yeah.
So osteoarthritis is the deterioration of the bone. Okay. So we know that something's happening in the bone structures. It's a breaking down. Sometimes there's bone spurs that occur, and there's lots of different types of osteoarthritis.
Yeah, so osteoarthritis is usually known as the wear and tear arthritis. So if you've got two bones like the femur and the tibia, say for osteoarthritis in the knee, gradually the end of the bone starts to wear down. That at that point doesn't actually hurt. It's only when it gets into the underlying structures where the nerves and the blood vessels are that it starts to hurt. So the early stages of osteoarthritis are completely painless, and it's fair to say that most of us over a certain age, about 35, nobody here obviously, have some degree of osteoarthritis, which we may or may not be in pain from, and that is the big thing, that deterioration of the bone does not necessarily lead to pain.
No.
And that's the big thing we can.
And it's key when somebody says, I'm in pain because I've got osteoarthritis and you can't help it. I think one of the key questions to ask is for them to go back to who's ever diagnosed the osteoarthritis and say, are my bones and structures deteriorating at a greater rate than somebody my age? And the point being, as Rachel said, is it's not necessarily the bones that are creating the pain.
Yeah.
Okay. So what we're interested in as advanced clinical massage therapists is decreasing people's pain and increasing people's range of motion with long-term chronic conditions. So osteoarthritis is primed for that because it's going to be a long-term condition. What we can do is increase the range of motion and decrease the pain.
Yeah, so I think osteoarthritis is quite interesting because certainly in our experience, a lot of the pain can be contributory factors in the tissues are actually myofascial restrictions and trigger points, and they without a doubt contribute to the pain experience. As we've talked about in previous episodes of Jing TV, that pain experience can also be amplified by by the client's belief about the pain. So if they believe that osteoarthritis is something that they're going to be in a wheelchair with, if they're really scared, if they're doing something called catastrophizing, which is really ramping the issue up, thinking I'm never going to work, oh my god, I'll end up in a wheelchair like Grace and Betty, then that will also increase the client's perception
of pain. Or they're being told they need to have surgery. So if they're being told,
can be great for that.
Well, because that's all that they can offer. So if somebody goes to the Western kind of pain management system, it's very unlikely that they're being offered soft tissue work. So what they're going to be offered is changing the bone. So something like a hip replacement, which is actually not a replacement of the hip, it's more of a coating of resurfacing, so that the structures can move in a more fluid manner. And so as a structural body worker, as a clinical massage therapist, what you can offer them is the smoothing and the moving of the joints by manual therapy. So first port of call here is cross-handed stretches, like over the joints.
Fascial work without
fascial work.
Brilliant.
Opening up the joint. Also, we do on our myofascial courses the idea of pulls, so a leg pull or an arm pull, like opening up, decompressing the joint, creating space. Then you want to treat all the muscles around the joint for trigger points. So if that's something like the knee, obviously you're going to work all the quads, all the hamstrings. You're going to look at the structures that are both on the lateral and medial aspects. You're going to work above and below the joint. We're also going to look at trying to increase the range of motion. And so one of the best tools you have for that is passive stretching. So particularly with somebody living with osteoarthritis, they don't do as much weight-bearing exercise as they used to, kind of thing. So walking up steps or that kind of thing. So what you can do when somebody is supine or sideline is you can take them through the ranges of motion. So a full hip range of motion or a full knee range of motion, which also engages the brain to realize those things are possibilities.
Yeah, exactly. And it's always within their limits, if you like. So I think what's good with the range of motion, that sometimes people get scared, particularly with hip osteoarthritis, is ask the person at the beginning what movements they can do, so they get to do that actively before you go in and do.
This is core to assessment, actually, is getting them to do the actions that are problematic actively. So if Rachel was my client, I'd say, okay, so show me what hurts you. So if she took me, and I would direct the internal and external rotation, the flexion, the extension, the abduction, and the adduction of the hip, for instance, and kind of mark, benchmark what's painful in that. And then when she's on the table, I can take her about 10 to 30% more than she can do actively. I can take her that much passively. And then I can get her to do it again after the treatment is over. And that's very different than engaging in physio exercises, which are really all self-motivated. And so one of the greatest things you have as a massage therapist is time. So you've got people on the table for 40 or 50 minutes. You can do stuff with them passively and then also engage in conversation and get them to do it actively on either side. So osteoarthritis is something great to become an expert in as a soft tissue therapist. It's something that people are doing research at Jing about, and is also something that we're encouraging all our advanced clinical massage therapists to really treat. And the best teacher is experience.
Yes.
So, when people say I have...
Not being afraid to treat people with arthritis.
When people say I have arthritis and you haven't treated it before, say, I know that other people have, and they've gotten great results, so I'm really happy to work it with you. And that's so key to chronic pain, because so many people are being told there's nothing you can do about it. So be a different person, be a different voice, and say, yes, there's something I can do. I can help you. I can help you help yourself with osteoarthritis.
Yeah. So get out there. I'd love to hear your tips on treating arthritis. So please tweet them, Facebook them, email us with them. We're always interested in what you have to say.
And come on the advanced clinical massage therapist and course in hip conditions or knee conditions, if that's what you're interested in.
Yeah.
All right. We'll see you soon.
Take care.